It gives me great pleasure to introduce this year's Carmichael Lecture, which is of particular relevance given the ravages of the COVID-19 pandemic. The lecture commemorates Richard Carmichael, who in 1795 was appointed Assistant Surgeon to the Wexford Militia and no doubt saw action in the 1798 rebellion. He became President RCSI in 1813 for the first of 3 terms, being elected again in 1826 and 1845. Together with Robert Adams, he established the Richmond School of Medicine and Surgery, which eventually amalgamated with RCSI. He was a founding member of the Medical Association of Ireland. In 1847, he assisted at the first operation in Ireland under chloroform anaesthesia, performed by John MacDonald. Our speaker today needs little introduction. He is a Dubliner, born in 1958, and studied English and philosophy at UCD. He began his career as a drama critic with the In Dublin magazine that many of us remember. He later moved to the Sunday Tribune. He edited the McGill magazine before becoming a regular columnist with the Irish Times. His views are forthright. He sees the consequences of inequality and discrimination and calls out hypocrisy and self-serving practice. He is also a philosopher, and his lecture today reflects on existential threats of the pandemic and the opportunities for future well-being in our society. I can think of no one better to deliver the 28th Carmichael Lecture with the title Public Health and Public Wealth.
Thank you very much. It's such a pleasure to be with you, even though we're making a virtue of the virtual. And a great honour to deliver the Carmichael Lecture, which has such a superb tradition and honours itself an extraordinary tradition of public service and of concern for the general health of the population. So I'm really very, very honoured to be with you. The odd circumstances that mean that we are seeing each other remotely, I suppose, have one upside, which is that they focus our minds somewhat on this broader question, which I want to address really, which is the nature of the relationship between public health and public wealth. In many ways, historically, that relationship might seem very obvious. But when the pandemic began to take hold in Ireland in the early spring of 2020, it certainly caused me, and I'm sure many other people, to think again about this relationship, because we were experiencing something that perhaps had been somewhat taken for granted even 50 years ago, but that we had somewhat forgotten, and that we would all like to have continued to forget. But nevertheless, we were brought up quite sharply against a reality that previous generations had always experienced, but that many of us had been fortunate enough not to have to think about. When I'm 62, so I'm much older, I'm sure, than many of you, but not than some of you. And those of you who are of a similar age to me will remember that for the first part of our lives, the idea of health as a public thing was inescapable for most of us. It was just there. It was there in the form of chest X-ray vans parked in prominent public places in our cities, where people could go in and have X-rays, as of course, as part of the campaign to eradicate tuberculosis. It was there for me. I certainly remember children in my class in school with calipers, which was a legacy of the polio epidemic of the 1950s. It was there in signs on the bus saying, "Do not expectorate." I think I never remember not knowing what expectorate meant, even though it was a pretty big word because it was just so common. It was there in rhymes that we learned as children. Coughs and sneezes spread diseases. The idea of communicable disease was just a part of the ordinary grammar of life. And if you were to fast forward then to the period preceding the pandemic, we had, broadly speaking, been afforded the luxury of being able to put a lot of those concerns to the back of our minds as citizens. I know those of you who are working in the healthcare system will not have put them to the back of your mind, but in general, in terms of public consciousness, the weight of that knowledge had been largely lifted. In many ways, the great pre-pandemic object is the Apple Watch. You know, for €500 or whatever, you can buy an Apple Watch which will tell you the oxygen content of your blood. It will monitor your sleep patterns. It will monitor your heart rate. It will, you know, give you minute detail on how much exercise you've taken every day and how many calories you're burning in real time. An extraordinary scientific achievement, but also an obsessive solipsistic concern with health as an individual aspect of the self. And this is a huge transformation, really, in public consciousness. The idea of what it meant to be healthy has largely been privatized. I'm not for a moment suggesting that those private concerns are not real and proper. Not all disease, obviously, is communicable, and undoubtedly being careful about how we exercise and about our diet, you know, have huge and known consequences in terms of diseases like cancer or heart disease that are not communicable. So I'm not dismissing those concerns at all, but it is nonetheless a remarkable transformation over that period of time as to what we primarily think health consists of. And what the pandemic, I think, brought home to certainly me, and I'm sure many other people, was the sudden realization that we had been living in a historical and cultural bubble, and a geographic bubble to some extent. This idea that health was primarily about what one did oneself was very much an aspect of privilege. The privilege of living in highly developed Western societies, the privilege of being able to afford the technologies that allow us to do this kind of monitoring, but also the privilege and perhaps almost the accident of having lived for decades in societies which have not experienced pandemics. This is not the usual human experience. I spent a lot of my life as a theatre critic, and one of the things you're very conscious of if you look at the history of the theatre is that, you know, one of the very earliest plays in the Western tradition, Oedipus Rex, you know, is the dramatic action is triggered by a pandemic. It's the plague in the city that forces people to ask questions about who they are, about the nature of the polity, about the nature of the society, and that's what causes the crisis. That's, you know, over 2,500 years ago. So this sense that really we've been living in this very, very privileged, but in fact highly untypical bubble of consciousness in terms of the way in which we think about health. And so what the pandemic, with all its horror and its terror and the grief and the suffering that it has caused, it's forced us to rethink as a society what the relationship between the economy on the one side and health on the other side might be, and also think about health itself. What is health? What does it consist of? And of course, it's jolted us back into the consciousness that health is first and foremost a public phenomenon. And it's that realization of health as a public phenomenon that actually has been extraordinarily important to the development of our economies. What we think of as modernity in modern society is very much tied up with the realization on the part of the wealthy and privileged that they could not enjoy health and safety if there were airborne or waterborne contaminants that might kill them and their children, as well as killing the very poor and marginalized. That you couldn't protect yourself from cholera, for example, if you did not have a clean water supply. And you couldn't have a clean water supply because as a private thing. I mean, unless you were so wealthy that you were able to entirely wall yourself off in some kind of private estate with its own water supply. If you were living in a city, even if you were living in the rich parts of the city, you were at risk. And a great deal of the progressive attitude towards health, which we see with Richard Carmichael and his colleagues and his generation, beginning to think about health education, health as an aspect of public policy, as well as a practice for doctors. A great deal of that actually is also an engine of wider social change. It created the need for example, sanitation systems. If you're going to have sanitation systems, then you need to organize your local government at a whole other level, and you need to involve the public in this, and you need to have a kind of democratic mandate for thinking about the conditions that contribute to an idea of health as a sort of common right, and this gradually generates whole new systems of governance, new systems of urban living, which are then crucial to the development of modern economies. So I think people 50 years ago would have taken this for granted and would have known this. It would not necessarily have come as any great revelation to anybody to say that you cannot divorce health from economics. And yet, one of the very striking things we found at the beginning of the pandemic was that the framing of public discourse around lockdowns in particular was very much about positing some kind of adversarial relationship between the economy, this thing called the economy, over here, and public health over here, as if they were separate things and as if they were not fundamentally intertwined. So a great deal of the difficulty conceptually in terms of public discourse around the pandemic was actually finding ways of arguing that yes, this the measures that will need to be taken to control the pandemic will have terrible economic effects, but they will be worth it for public health. And then after periods where you've successful lockdown, saying, well, now we can let the economy begin to function again, as if the economy could function without having to pay attention to what the virus might be doing. So this kind of opposition, I think, told us something about the way in which our attitudes to the relationship between economics and health had actually been altered during this period of privilege, but also how we may need to radically rethink that relationship, hopefully as we begin to come out of the pandemic. I'm not suggesting that there's any compensation or consolation for the terrible human suffering that the pandemic has caused worldwide. But as human beings, we do have to try to make the best of calamities and to try to use them as ways to make us think about things that we ought to have thought about before. One of the things that we ought to have thought about before, and indeed that we were thinking about, and it's been there for a long time, has been the inadequacy of the ways in which we talk about the economy. So I was just looking back on one of the people who developed the idea of GDP, gross domestic product, as the single most important measure of the economy. Simon Kuznets, he developed the measure, but in 1934, I noticed him writing about warning and saying, look, this is a really useful measure, but, and I quote, the welfare of a nation can scarcely be inferred from measurement of national income. And warning really that national welfare and national income are not the same thing. Now, this is complicated, of course, by the fact that, well, two things. One is that, of course, national income does have a huge impact on national welfare. It would be incredibly naive to suggest that we do not need economic prosperity in order to have high levels of public welfare. The other thing that complicates it, of course, is that GDP is much more easily measurable than a notion like welfare. Like, what does it mean, the public welfare? Public welfare is much more open to value judgments and to debates than an idea of the measurement of GDP might be. But nonetheless, it's very striking that particularly since the late 1980s, early 1990s, economists themselves have been arguing that actually this obsession with GDP very much distorts our public consciousness. It stops us from thinking about what do we really want as societies. And people like Joseph Stiglitz and Amartya Sen have been making these arguments for a long time, that we actually need to have different kinds of ways of measuring progress. GDP is useful in some ways, but it's very distorting. We know this particularly in Ireland because we're one of the countries most affected by the distortions of GDP in the world because of our enormous dependence on multinational corporations whose shifting of money can distort our GDP. People may remember leprechaun economics, that phrase used about the fact a couple of years ago that Ireland had a growth rate in 1 year of, I think, 27% of GDP, which was unprecedented and unheralded and perhaps not quite real, therefore. So we sort of know in Ireland that GDP isn't a very good measure, and we've been looking at other things like gross national product and gross national product with a star and GNI. There's been lots of different ways of trying to measure the same basic thing. But actually, I think one of the things that the pandemic forces us to do is actually broaden that way of thinking about how do we measure the public good, and how do we integrate our idea that there's this very fundamental connection between health on the one side and wealth on the other. How do we integrate that into thinking about progress? And again, this isn't conceptually particularly new. As long ago as 2009, the National Economic and Social Council, I think, began to develop what are called a well-being index. And actually, I think did a version of it for that year, which had a whole range of different kinds of indicators and tried to look at this. Ironically, 2009, was probably the last year of the Celtic Tiger, and all of that kind of thought, in a way, that kind of way of thinking about, okay, what is wealth? How do we really measure it? Was suspended in the last great crisis, the banking crisis, it seemed like there was no space for this kind of thought. But the pandemic has really kind of forced us to begin to reassess, I think, that sort of impulse. It's worth pointing out that even though we in Ireland kind of stopped developing some of this methodology for thinking about progress, lots of other countries have been doing it. And I think this culminated in 2019. I think the first country in the world to have an annual budget called the well-being budget was New Zealand. Perhaps not entirely accidental that New Zealand is led by a young woman who perhaps has a wider and deeper perspective on the public good than the one that's been traditionally applied. But nevertheless, very, very strikingly, New Zealand was able to, alongside a sort of traditional budget, come up with what's called a well-being budget. And I think it's that concept of well-being which really has to be one of the things that we rescue from the awfulness of the pandemic. At its starkest and simplest and most brutal, what the pandemic has reminded us of is that it is impossible, first of all, to distinguish my health from your health. There is no cordon sanitaire. There is no way of building walls against invisible viruses. There's no way of seeing health as other than collective. We know, just to take the most obvious example, that a vaccine won't work unless the public in general buys into it. There's no utility in vaccines that are personal. A vaccine cannot be for you or me. It has to be for the vast bulk of the population in order for it to be effective. So that sort of distinction between my health as monitored by my Apple Watch and the public health, I think, has largely been abolished by the pandemic. But of course, what the pandemic has also abolished then is that sort of conceptual distinction between economic progress and economic thriving on the one side, and the health of the nation on the other side. The idea of closing down the economy to get the population back into a healthy situation, and then stopping the health measures in order to get the economy going again has been proven to be very, very deeply problematic. What we know, and should have known really without the pandemic, is that there's an inextricable relationship between wealth and health. And it's a relationship which is symbiotic. This, I suppose, is what the Victorians really began to realize. You cannot have a thriving economy in which large parts of the population are consigned to perpetual ill health. And equally, you cannot have a consistent progress in health without a thriving economy, without prosperity. So good public health helps to create prosperity. Prosperity helps to sustain and further our ideas of what good public health mean. Just take two very obvious measures. On the one side, we can see, and Ireland is a very dramatic example of this, we can see very, very direct relationships between the growth of economic prosperity in Ireland and life expectancy. So, the number of years that we have to live is directly correlated to the prosperity of the economy. But it's also related to it in a way that can't be taken for granted. It relates to it through social justice, for example. So the benefits of economic prosperity leading into greater life expectancy will not be experienced automatically equally by everybody, right? There have to be very large kinds of interventions in the way in which the benefits of economic growth are distributed in order for those benefits of life expectancy to feed through. But on the other side, you know, Ireland's economic prosperity, for example, is hugely dependent on the proportion of the population that's active in the workforce. A lot of the economic difficulty of Ireland in the 1980s, for example, and in much of the 1990s before the Celtic Tiger, very much linked to the fact that very large parts of the population were economically inactive. And we know that even in times of economic prosperity, large numbers of people will be economically inactive if their physical and mental health is poor. And that has a huge effect, of course, then on economic productivity, on state finances, on state finances at both levels, both how much money the state is taking in and how much money it has to spend on welfare services, for example. But we also see this kind of symbiotic relationship all the time, and it exists. And I think this again is the other area in which consciousness has been altering, perhaps too slowly, but nonetheless very perceptibly. Is our consciousness of the relationship between health and environment. Again, this would have been something that I presume Richard Carmichael would have taken pretty much for granted. You know, that in the 19th century it was becoming more and more obvious to people that if people were living in filthy conditions, if they were drinking polluted water, if they were working in jobs that exposed them to contamination of all sorts, then their health was going to be fundamentally compromised. Thankfully, with better labor laws, with better public health standards, some of those concerns diminished. But they've returned, I think, in a huge way with our rapidly increasing and more and more urgent consciousness of the fact that in the long term, the idea of a healthy society is entirely unsustainable without thinking about the quality of air, the quality of water, the quality of food, the safety of food, but also the sustainability of the planet itself that produces all of these things. So I think we're at a moment where the lessons of the pandemic are also beginning to interact with the increasing consciousness of the broader environmental nature of public health. And this, I think, is a large part of the opportunity that we might have coming out of this. So finally, where does this leave us and what might we do? Well, it seems to me that what the pandemic has done, as I said, is not so much produced new circumstances, but reminded us of truths that we probably always knew but had tended to forget, but also provided us with incentives to really become serious about things we've been talking about for a long time but haven't done. And a very big part of that, I think, is to place at the center of public policy this idea of well-being. What well-being does as a way of thinking is it thinks about the economy as part of a wider nexus that includes health, both in the immediate sense of the health status of the population, but also in the wider sense of the factors that contribute to people enjoying a decent life, which is physical health, but also, of course, mental health, but then also the quality of relationships, the nature of community, the way in which we interact with each other, the possibilities that emerge for all of us to contribute to each other's health, both in terms of our daily interactions and in terms of the kind of public policies that we endorse and demand. The hopeful thing, perhaps at the end of this very, very, very grim period, might be that this notion of well-being can be placed at the heart of our public discussion, of the way in which we talk about what it is we want as a society, and the ways in which our politics are conducted. It's very promising and largely coincidental that one part of the Programme for Government of 2020, which was being formulated just as the pandemic was hitting, was the idea of trying to emulate, for example, New Zealand in having a well-being budget. Perhaps we can finally do this. Perhaps we can see the period of the pandemic as we come out of it as a period of mourning and of grief, but also as a period of awakening. We have learned things about each other, about ourselves, and about our societies, and one of those is that any consideration of public wealth that does not consider public health will be conducive neither to the growth of wealth nor to the growth of health. Thank you very much.
Fintan, our thanks and congratulations on your lecture. Like you, I remember the mobile chest X-ray units for TB, one actually outside the college at the top of Grafton Street. I remember the children with calipers because of polio, and the cube of sugar with the little drop of vaccine for polio. I am pleased to present you with the Richard Carmichael Medal. Fortunately, the medal is real, although the presentation is virtual. Thank you again.